about knowledge translation, or as we'll discuss later, implementation science or dissemination and implementation. But for now, we'll talk about it as knowledge translation. The learning objectives for today are to understand the background and goals of knowledge translation and implementation science, and to identify strategies used to implement knowledge translation. A few weeks ago, we talked about reliability in terms of assessment. This week, when we talk about reliability, we're talking about quality of care. So when we talk about reliability in industry, we're talking about how many failures there are. When we talk about reliability of air travel, for example, we're talking about the failure rate that's resulting in a plane crash. And the airline industry records that there are 1 in a million there's 1 in a million failure rate that results in a plane crash, and the reliability rate in air travel is 99.9999%. Just to know that the next few slides are from Becky Reeder, who is one of the leaders in knowledge translation in the occupational therapy field. She's an occupational therapist. She has her OTD, and she manages, I think it's the entire rehab department at Cincinnati Children's Hospital, and has spearheaded a number of evidence-based practice guidelines that you can download at the National Guideline Clearinghouse. She is also a leader in a number of the slides are talking about her experiences at Cincinnati Children's, raising the standard of care in her organization. She also presented, and this information was from her presentation. AOTA sponsored a session on knowledge translation at conference this past April that was in Nashville, and she presented on her team. In a study published in 2007 on the quality of healthcare in the United States for children, the records of 1,500 children were reviewed. It was from a randomized sample, and they reviewed 175 indicators of quality of care for 30 acute and chronic conditions. The children in the study, authored by Mangione Smith, found that these children received 46.5% of the indicated care. And this is in comparison to the airline data that was just mentioned of 99.9999%. Quite a difference. The conclusions of the study were that deficits in the quality of care provided to children appeared to be similar in magnitude to those previously reported for adults. Strategies to reduce these apparent deficits are needed. The question can be raised, why does that occur? Why do children receive less than half of recommended medical care processes, and why is there a gap between what we know works and what is actually done? And the answer is that because an enormous amount of scientific literature remains unused and not translated into practice. According to Don Berwick, who is a leader in implementation science and knowledge translation, failing to use available science is costly and harmful. It leads to overuse of unhelpful care, underuse of effective care, and errors in execution. According to Becky Reeder, there needs to be, and her team, and this was the model for what her team used, is they needed to develop a culture shift, that there was an obligation to provide evidence-based care to every patient who entered their doors. And the keystone habit was that to focus on delivering best evidence-based care, and from there forward, everything was focused on that habit. And actually, we're not going to be talking about the results, what she's done, but she and her team were very successful in making sure that everyone who worked at that department was focused on that keystone habit and was really quite successful, no matter how long someone had been out in practice, no matter how long the experience of the person, they were able to make the switch. And I'll mention that in a few minutes, what they did, some of what they did. We'll talk about the tasks they used and how they did it more towards the end. Okay, let's look at a definition of knowledge translation. And the knowledge translation term comes out of Canada, but the term we'll talk in the next slide about implementation science, which is often used in the United States. But the reason we're focusing on knowledge translation here is that the National Institute on Disability and Rehabilitation Research, NIDR, uses knowledge translation as the term for rehabilitation research. So we're going to be using that as we go through. But we'll talk about implementation science because you will hear it as you go through your careers. Knowledge translation is a dynamic and iterative process that includes synthesis, dissemination, exchange, and ethically sound application of knowledge to improve the health of Canadians, provide more effective health services and products, and strengthen the healthcare system. So knowledge translation, the goal is to really strengthen the healthcare system, but to apply knowledge to improve health. Similarly, implementation science, and this is a definition from the NIH, is the study of methods to promote the integration of research findings and evidence into healthcare policy and practice. So research findings go directly into practice and into healthcare policy. It seeks to understand the behavior of healthcare professionals and other stakeholders as a key variable in the sustainable uptake, adoption, and implementation of evidence-based interventions. So it has the assumption that you can have the research and you can have really knowledgeable people, but often behavior doesn't change. And that's what we'll be talking about somewhat, is how you get that change. So the goals of knowledge translation are to increase practitioners' understanding and the use of evidence in practice, improve clinical practice and client outcomes, really look at what works, and to see how can we disseminate and implement this knowledge in practice. For more information on knowledge translation, NIDR went to Melanie Barwick, and I think you should look at her information, and there are a couple examples of short videos that are posted of her work. She is a psychologist. They're posted on in this week's session. Melanie Barwick is a psychologist, and she works in Toronto at Toronto Sick Kids Children's Hospital, and she is focused in the area of knowledge translation. Her work is really helpful because it gets you to think big, to think differently, and to think how you are implementing your work in practice and who you need to bring into that. If you go to her website, and actually the knowledge translation planning template that we'll be talking about is there, and it's posted on this week's session. You'll also find some monographs and implementation tools that are there. When we look at her knowledge, and just to back up a little bit, after listening to her work and listening to her presentations at a NIDR workshop, AOTA has taken the knowledge translation planning to heart and to really look, and we'll talk about this in a few minutes, to say, what is AOTA doing and what can AOTA do to increase the implementation, to the use of knowledge and the translation of knowledge into practice? And how far can our boundaries be? And how can we bring others together to really disseminate that in practice? So the template that she developed is really a way for researchers and non-researchers to get their message out. It helps you look at project partners, the degree of the partner engagement, how you want, where you want people to get involved. For example, if you want clients to get involved and families to get involved, what their roles will be, what all the partners that you're going to bring in will be. What kind of knowledge translation expertise do you need on a team? It also looks at who are going to be the knowledge users of your information. What are the audiences that you want to target with your message? So some of this is very similar to what was discussed last week, and some of it goes to a sort of a broader message, but really the same kinds of questions that you would ask that you asked last week, but somewhat slightly different ones. What are the main messages that you're looking to get out there? What are your KT goals? And we'll be talking about that. And what are the strategies we're going to be using? And we'll also talk about these in a few minutes. What process do you plan to use for KT? And what impact do you want to make? And we'll also be talking about that in a few minutes. So, goals for KT. What is your purpose in sharing what you've learned? Either through your reading or through research that you're involved in. And these goals will guide and organize the efforts that you put forward. For example, you may decide that you want to generate awareness and interest, so that the message may be that I just want people to really know what I'm doing. I want to get it out there. You might want to share knowledge. You might want to inform future research, that your message is then to go to researchers and say, you know, I just found this out. Let's look at this. How can we do that? You might want to generate practice change for practitioners, or the information that you're sharing may be with your clients and you want to make some behavior change, or you want to generate some policy action. The components of a KT plan ask, what are your KT goals? Who are your target audiences and knowledge users? How will you engage them? When will you engage them? What are your main messages? What case strategies will you use? How will you implement your strategies? With what impact will they take place? So, for example, are you going to be having an evaluation strategy to determine the success of your KT plan, excuse me, and its impact on health? And what resources are required, such as budget, staffing, and the like? So these questions, while they help you, while they may be hard questions because they sort of ask questions that you didn't think of, in the end, these questions really help you to drill down and focus on what you need to do to make a difference. So going back to Becky Reeder and thinking about this slide, sort of pulls some of this stuff together from the readings, which was focused on models. Some of the research looks at what makes a difference, and what Becky Reeder did actually implemented in practice. In the reading today, there's a lot of the reading is that the models that we have for knowledge translation, and In speaking to other people in knowledge translation, some people are very involved in having a specific model, whereas other people who do research in the area of knowledge translation do not use a model. But what we do know, whether you, excuse me, just need to drink something. Excuse me, whether you use a model or not, is that there is evidence that certain things work better than others in terms of making an impact. For example, the research shows that just purely educational materials and didactic continuing education, they're in red because there's not evidence that those make a difference in practice. However, small group meetings, communities of practice, knowledge brokers, and people who translate evidence in a workplace, and opinion leaders, there is lower quality of evidence, but there is some evidence that those can have an impact. The research shows that audit and feedback, peer comparison feedback, and quality improvement provide high quality evidence to help people implement evidence in practice. So, for example, what Becky Reeder shared was that they used audit and feedback. So they looked at individual therapists, what they did. They provided an audit and gave them feedback of what they needed to change in their practice. Obviously, it was done nicely. They compared information from their peers they got feedback about what their peers were doing, and they worked in the area of quality improvement. And this is where, together with small group meetings, communities of practice, knowledge brokers, and opinion leaders, together they were able to have a huge impact on how things were done in practice. So going back to what AOTA has done, initially when we were trying to implement evidence in practice, we have this slide, which I think you have seen previously, that on the left looks at our AOTA reviews, and on the right looks at how things were implemented in practice. So we have a variety of materials that have been developed to help people make behavior changes. But as we started looking at knowledge translation, we realized that it's an extremely complex process, and the question could be raised is whether we could really, on an individual clinic level, make those changes. And the answer is that we can provide materials, but the goals of AOTA are not to go to individual clinics. But the goal of AOTA is to make sure that we disseminate that information and provide places for experts in the field, for leaders in the field, to come and disseminate that information and seed that and sort of then go and help develop communities of practice that people can then have best practice and feel that they have peers that they can work with. So our first goal, we had this, as I mentioned, there was a session at conference, and we brought together leaders in the field to present to conference, to present to, there were clinicians, there were researchers, there were faculty members, and there were administrators in the audience. And these people, then we having meetings and trying to then facilitate that out in the field. But what we also did was to make a direct KT plan of what our own information, and to look at where we are most effective. And we wanted to make sure we did sort of an audit of our own information to see where we were generating awareness and interest, and which products could then really go and provide a practice and behavior change. And knowing that the effectiveness of those products may vary. We also have done work in policy action, and we continue to do that on a regular basis. So we looked at Evidence Bites, Evidence Perks, Journal Club Toolkit, and you can find these on our website. Some are, you need to be a member to access them. Some are available without being a member. I think so. Some of the products we're going to discuss. And we have the research opportunities table that's online in an AJAT that I know Deborah spoke about. Deborah spoke about all of these at the first session of all of these materials. We have Everyday Evidence podcasts and SIS newsletter information. In terms of practice and behavior change, and we have the Journal Club Toolkit, again, conference presentations, practice guidelines, the cats that we have, and actually the mini cats that we use. We've gone to making very small summaries, critically appraised topics, and those were developed based on our work on knowledge translation, because we realized that the messages were too long. People weren't reading those messages. So we started to develop shorter messages. This is from some of the work that Melanie Barwick has done on about the length of the messaging that you have. And we shortened them, and they seem to be more effective. The evidence exchange, AJAT articles, and continuing education that we have for AJAT articles. So these are some of the references that Becky Reeder used that were mentioned in the on the slides, and hope that you give some thought to knowledge translation and how you, either as a student, can sort of prepare yourself to being involved in knowledge translation, or in your clinical practice, or in your academic life. How can you then think about what you're doing and making a difference? So have a great week, and we'll connect soon. Bye-bye.